Steroids are our last class of lipids that we are going to cover for this chapter, and they are one of the more important lipids in your body. And one of the most prominent steroids that we get to talk about in the next couple of slides is cholesterol. All right, so steroids have a really unique looking structure compared to all the other lipids that you've seen. They don't have ester bonds, there aren't 3 fatty acids, there's no amide linkages. They are so unique. So steroids their basic structure is a set of 3 to 6 membered rings and a single 5-membered ring fused together. So what you will often see is what you were seeing in the image here. You're going to have 4 rings that are fused together. We like to label them from left to right, A, B, C, D. Those are your 4 rings, and anytime that you see those 4 rings in class, you know you're dealing with a steroid. So when it comes time for the quiz, what you're looking for are those 4 fused rings together. I will not make you memorize any of the specific functional groups that would differentiate, say, cholesterol from some of the sex hormones or the sex steroids. So just be on the lookout for those 4 fused rings. All right, as we said on the previous slide, cholesterol is the most abundant steroid in the body. 25% of cholesterol in your body comes from diet. 75% comes from your own liver, which synthesizes cholesterol in the body. A couple decades ago, there was a big push to limit the amount of cholesterol you're taking in through your diet because that was supposed to decrease your risk of cholesterol-related health effects. But now we're finding that it's really your genetics that are at play. How much cholesterol does your liver make due to your genes? So if you were to have above normal blood cholesterol levels, you can get buildup of cholesterol and you can get gallstones as a result of that. You can also, if your blood cholesterol levels are high in your arteries, the cholesterol can build up on the walls of your arteries. It can harden there. It can create a thick plaque. That's arteriosclerosis. So there's a lot of bad side effects from that as well. In a couple slides from now, we'll see what a artery looks like that has a buildup of plaque in it. All right, so this is the structure of cholesterol. Notice we have our 4 fused rings. This would be A, B, C, and D. The functional groups are different, and in this case, I'm not asking you to memorize those, but just recognize that this would be considered a steroid because it has those 4 fused rings together. So cholesterol is so present in your body everywhere. It is in almost every single body tissue that you have. Thinking back to our cell membrane podcast, the lipid bilayer in your cells has cholesterol in between each of the phosphosylglycerols so that they don't pack too tightly together and become solid. It helps to maintain that fluidity. So cholesterol is a good thing to have in that situation. We just don't want our liver to run away and make too much of it. It's also important for the synthesis of vitamin D because it is a starting material for that. It's also the starting material for other steroids as well that your body needs. So it's not necessarily a bad thing to have in your body. It's a bad thing to have a lot or an overabundance of it in your body. All right, so you probably heard a lot about good cholesterol versus bad cholesterol, and let's get to the bottom of that. Cholesterol has to be transported from your liver to the tissues in the body. And remember that cholesterol is nonpolar. It has a lot of hydrophobic regions. So in your bloodstream is water, so we're going to need some sort of vesicle to carry your cholesterol. So lipoproteins are what do that. Lipoproteins are exactly what they sound like. They're lipids and they're proteins, and they are water-soluble complexes, and they have a hydrophobic interior that your cholesterol can sit in as it travels through your bloodstream, which has water in it. There are 2 types of lipoproteins. There are high-density lipoproteins, HDLs, and there are low-density lipoproteins, or LDLs. HDLs are your good cholesterol. These are going to transport cholesterol from the tissues to the liver to be eliminated. So if you have excess cholesterol in your tissues, in your bloodstream, it's going to pick it up, take it back to the liver, eliminate it, and it removes cholesterol from the body. Your LDLs go the opposite direction. Your LDLs are considered your bad cholesterol. These transport cholesterol from the liver, and they transport it to the tissues and drop the cholesterol off at your tissues. Now, you have to have some of this because all your tissues are going to need cholesterol. But you don't want an overabundance of LDLs because they're going to be dropping off a ton of cholesterol that your body doesn't necessarily need. So we want high levels of HDLs. Pick up the extra cholesterol, get rid of it. We want lower levels of the LDLs, so we're not just depositing a bunch of cholesterol. Bile is synthesized in your liver as well from cholesterol, and it's stored in the gallbladder. And the purpose of that bile is to help break up fats and oils. And in one of your labs this semester, you guys are going to be using bile salts in order to break up some large oils and see how those work. All right, so let's take a look at the structure of a lipoprotein. There are large protein portions to your lipoprotein. Your HDLs are going to have more proteins than your LDLs are going to have. And we have phospholipids with their polar heads sticking out, and notice that their hydrophobic tails, those hydrocarbons, are facing inwards. This entire region inside, all of these little red dots, these are all your cholesterol molecules. Those are going to be stored inside. Inside is hydrophobic, but since the surface has polar or ionic groups, it can therefore travel in the bloodstream and around the body without being inhibited. So think of these as being like these little vesicles that just carry your cholesterol either from the liver to the tissues, LDLs, or from the tissue to your liver for elimination, HDLs. Right, going into healthcare, you are definitely going to have to run lipid panels on your patients, and it would be important if you knew what that meant. There's a lot of different recommendations. The FDA recommends less than 300 milligrams per day of cholesterol be taken in your diet. Being as we're Americans and we go big or go home, we usually average 400 to 500 milligrams of cholesterol per day. So we already overdo this. Again, 25% comes from your diet. Your liver is making the rest. So if your liver is making a ton of cholesterol already, you definitely don't want to take in even more from your diet. So if you were to get a lipid panel done, the National Cholesterol Education Program is going to recommend that your total serum cholesterol be less than 200 milligrams per deciliter. We would like to see your HDLs above 40 milligrams per deciliter. That's the good stuff. You want it picking up all that extra cholesterol, taking it back to the liver, getting rid of it, because that lowers your blood cholesterol level. Your LDLs should not be greater than 100 milligrams per deciliter. So we want to make sure that you're not dropping off more cholesterol, which can lead to a buildup of plaque on your arteries or closing off of those arteries. We want to make sure that your HDLs can handle picking up that excess cholesterol. All right, so let's take a look at what happens to your body when you have excess cholesterol in your bloodstream. So this top artery, this is a cross section of an open artery. Remember that artery walls are going to be thicker than vein walls because they're going to be pushing or pumping blood. So this pink part is going to be the wall of your artery. That's a healthy artery. You have a nice big space in there for the blood to travel through. When you have excess blood cholesterol levels, you're going to get a buildup of plaque on your artery walls. Well, eventually, and what you're looking at here, this is all buildup on your artery walls. Eventually, look at this narrowed space. Your blood has a lot less space to travel through this artery when you have, and it's called an occlusion. And I'm not sure how they do the percentages, if that's subjective. They would say your coronary artery is 90% occluded or whatever. When this starts to get blocked off or completely closed off, blood can't flow through. That's what we would call, if it's a coronary artery that gets blocked off, we'd call that a heart attack. And no blood is crossing through. The other issue with having a plaque buildup on your arteries is if any of you are older brothers or sisters, this is what I think of the most. If you wanted to spray your little brother or sister with the hose in the summertime or the winter, I don't know, maybe you're mean. they can run away from you. But if you take your thumb and put it over that hose, you get a further distance because you are blocking the flow of water, which means the water that is coming out has a tinier hole to go through. Therefore, it has higher pressure and you can shoot that water further. Think of your arteries as being the same way. If you're going to close off part of that artery, there's going to be a buildup of pressure. It's going to take more power from your heart to pump that blood through that smaller opening. This is going to lead to an increase in blood pressure. Your heart is working harder. Your heart is a muscle. The harder it works, it tends to get a little bit bigger. However, when your heart gets big, it gets less effective at pumping. It's not the kind of muscle you want to build. Enlarged hearts are not a great thing to have. So what do? We have statins to help us with cholesterol. So what you're looking at is lovastatin, which naturally occurs in oyster mushrooms. This was the first statin to be marketed. And the function of a statin is to lower the cholesterol in the bloodstream because it blocks the synthesis of cholesterol at early stages. So it's helping to prevent your liver from making all the cholesterol it's trying to make. Hopefully you won't have to go on lovastatins because you'll be able to with diet manage most of it, but again, a lot of this is genetic. So it could be potentially that you just have inherited a gene to make a lot of cholesterol. All right, so the other class besides cholesterol of steroids that are important for us are going to be steroid hormones. And these are chemical messengers that are going to trigger a specific response in the body. The first type is considered sex hormones, or sex steroids. In males, we call those androgens, like testosterone or androsterone. These are found or made in the testes, and they're responsible for secondary sex characteristics. In females, we call those estrogen or progestin. So when we talk about estrogens, we're talking about estradiol and estrone. These are estrogens that are synthesized in the ovaries. And I want you to notice the end of these. Estradiol is two alcohols. Estrone is a ketone. Testosterone, andron. These guys have ketones on them as well. So estradiol and estrone are responsible for secondary sex characteristics as well as the menstrual cycle. Progestins, like progesterone, are responsible for prepping the uterus for the fertilization of an egg. So both of these have very different functions, but they still are characteristically in females. Anabolic steroids is probably what you've heard a lot about. These promote muscle growth. These were originally used to help people who had muscles that atrophied after surgery, help them build those muscles back up again, but they've been popularized by bodybuilders and athletes, although they're not allowed to use these. There are a lot of physical and psychological problems that result from the prolonged use, which is why they're not allowed. Other steroids, adenocorticoids, you're probably learning about this in anatomy and physiology. These are produced by the adrenal glands, which are right on the top of the kidneys. And aldosterone, prednisone, cortisone, and cortisol, those are all considered adenocorticoids. Aldosterone is responsible for regulating blood pressure in the body. Prednisone and cortisol are anti-inflammatory agents, and they also help to regulate carbohydrate metabolism. Cortisone specifically, let me see if I have, cortisone specifically was used to suppress organ rejection after transplant, but lately it's also being used to treat allergies as well as autoimmune disorders as well. However, the prolonged use of cortisone, say for autoimmune disorders or allergies, can lead to bone loss as well as high blood pressure, so those have to be carefully monitored by medical professionals. And I just want to take a quick second and look at the structures of aldosterone, cortisone, and cortisol. So again, notice this basic ring structure. It's a 4-fused ring structure. If I were to see this on a quiz, I would know that that's a steroid. That's at least the class of lipids I should be in. Aldosterone has these two ketone groups. Cortisone also has the same two ketones in the same positions, but it has a third ketone group. Notice that these are just very similar in structure, and you're going to see that a lot with steroid hormones. You're going to see that a lot. They're going to differ by one or two functional groups, and that can make the world of difference for their physiological function just by changing one of those functional groups on your steroid ring.